Dr. Roizen joining us. I appreciate you being here, Doctor. Thank you again for making time. But should we be freaking out about the measles outbreak?
I don't know that freaking out is the right thing. If you are immunocompromised, you've got to isolate and worry about it. And if you're under treatment for cancer chemotherapy, you probably should worry about it. Other than that, it probably is not something you have to worry about. Meaning, if you've either had the measles, as most people over the age of 50 have, or have had the vaccine, as whatever it is, 90-some% under the age of 50 have, then you don't have to worry about it. Now, the problem is the older we are, and if we are immunocompromised, then you can get a very bad pneumonia with it, which makes it difficult to oxygenate and may require some time in the ICU. So the key is avoid that West Texas area, avoid contact with people who have it if you're immunocompromised. It's the only real people who have to worry about it are those who are immunocompromised or on cancer chemotherapy type therapies.
So these little outbreaks seem to pop up every decade or so, and for whatever reason, I'm not sure.
Wait. It's pretty clear why it's in this area. One is someone got it, and because many of the kids had not been vaccinated, there was an outbreak. It's pretty easy to avoid this one. You get vaccinated when you were a kid, or in our day, when you and I were young, when we were healthy, we were exposed to other people with it, and that was easier for us.
Yeah, I remember measles parties. If one of the kids in school got it, the other moms and dads would say, hey, can I send my kid over to get it so they can get it and get over it? That was kind of a standard operating procedure.
Yeah, so when you're a kid, you're able to fight it off much easier. And because you had a party, and essentially you got everybody in the school with the same grade getting it at the same time, you didn't miss a rolling schedule of classes. Everyone missed the same thing, and so the teacher retaught that same thing at a later time, so you didn't miss that part of school.
So the reality is, if you're immunocompromised, if you're on chemo, yes, avoid the measles by avoiding the areas where these outbreaks are happening. Generally, healthy people will survive it. And if you're vaccinated, and the vaccine lasts for your lifetime, Doctor?
Yes.
Well, that's cool. I know a lot of people were questioning that because sometimes you have to get vaccines boosted, if you will. Great stuff. Speaking of vaccines, a lot of questions, a lot of people asking, do we have too many vaccines mandated when babies are born in this country? I've heard a number as high as 72 vaccines are required in the first 6 months of a baby's life. That seems excessive. Is that even close to true?
Well, the required isn't, advised is. So Dr. Oz and I, in our days of writing books together, called and talked to 150 experts in the field, or so-called experts in the field. And literally everybody on the anti-vaccine, from Sherry Tenpenny, and on the pro side, Paul Offit, but literally everybody in between. After we got through, we wrote a chapter on it, which is in 2 of the U-books, What to Expect essentially when you're pregnant and you raising your child.
Okay.
And we put it on the Dr. Oz site and on the Oprah site. And of course, after we did it, no one on either side would talk to us. So the childhood vaccines, there are about 55 of them at that time. There are a few more now. I don't know if 72 The last I saw was 58. The point is, like MMR, they're given 3 at a time in one shot, if you will. But in any case, we believe there's a risk to vaccines. That risk is a very small risk, and because of the vaccine controversy, the vaccines have become safer. There's a strong benefit. What's the benefit to risk ratio? It's about 40,000 to 1. It's like putting $1 down when you're a kid and getting either 40,000 back or losing the dollar. Almost everyone would take that 40,000 to 1. So we said there was a huge benefit to risk. No one would talk to us. Why? Because we thought the schedule should be changed to do exactly what you said, to lessen the burden early, since many of the diseases that you're getting vaccinated against don't occur early or unlikely, very unlikely to occur at that time in your life. So the only people who would talk to us actually was the CDC people who were on the vaccine group, and we did PSAs for the CDC in that era to talk about the benefits of vaccines over risks. We believe there's a strong benefit, and we believe the schedule can be altered. And in the book, You Raising Your Child and You Having a Baby, in both of those books are a series of pro-con debate chapters and why we came out on that side. We not only talked to 150 experts, but we read about 1,000 papers on the issues.
It's interesting to me, and I hear the discussion ongoing, and I know there's a lot of questions that have also been raised, not just about the childhood vaccines and whether or not there are too many of them, and communication is obviously important with parents and their pediatricians before they approve of anything. Is there a chance, as we've been told, that all these vaccines could have caused the huge spike over the last 20 years in things like autism?
You know, the data is so against that it is very unlikely. Is it possible? I suppose anything is possible, but it is very, very unlikely. Now, the one thing that sometimes people could cite is that there may be a change in microbiome that allows a different immune functioning after all these vaccines, and that may allow either autoimmune disease or some other issues. But because of the studies that have been done, it's thought the chances of that are less than about 1 in 100,000. So if you say, is this absolutely ruled out? It's as close to absolutely ruled out as we can do it based on the studies that have been done.
So how do we figure that the rates of autism have escalated so radically in those last 20 years?
You know, I am not an autism expert. My wife is. She ran 2 large treatment centers for autism, one at the University of Chicago and then at the Cleveland Clinic in Case Western Reserve. So I'm going to give you her answer to this. One is there is a definite increase, no doubt, and most people think it is due to things in the environment. 2, you can decrease the chances by over 60% if you get prenatal vitamins. So taking prenatal vitamins in that population, it's not a very large increase. It's the increase in people who aren't getting prenatal vitamins that is so large.
Okay.
Third, there is a economic benefit to having the diagnosis of autism because you get many more services than if you just said mental dysfunction. So that a lot of the increase, about half of it, half of the total increase, is caused by the way the economic system works compared to the way it worked in the past from a standpoint of getting services for your child. And then the other thought is that it is chemicals in personal care products and the chemicals in the environment and in preserved foods that have some way of increasing the risk. So the answer is we don't know, but probably a major part of the increase is due to the benefit that diagnosis confers. Another major part is probably due to the increased chemicals in personal care products and the lack of eating balanced diet since fast food has come in, and consequent lack of vitamins in our food, and that a fair number of pregnancies are accompanied by not taking prenatal multivitamins for 6 months before pregnancy in both the man and the woman.
So guys have a role in making sure they have a healthy child as well. It's not just on the woman when she gets pregnant.
If they're thinking about having a child, they should be taking prenatal multivitamins for 6 months before conception as well.
My buddy is Dr. Michael Roizen. He is from the Cleveland Clinic, but you have to check out longevityplaybook.com. It's a website that'll help you live younger, longer, better, and that's what we all want to do. Great newsletter, great information every week. Dr. Roizen, thank you for letting me pick your brain. Let's do it again next week.
My privilege. Thank you.